Hi, I'm Dr Geoff Cashion and I'm a full-time vasectomist and founder of Vasectomy Australia, Australia's largest provider of no-scalpel vasectomy. In this video, I'm going to give you the information you need about vasectomy to help you decide whether it's the right option for you and your family. The goal of vasectomy is to achieve permanent sterilisation so that you won't be able to have children. Vasectomy is a simple procedure that takes about 10 minutes to complete. It's done under either local anaesthetic while you're awake, or you can elect to have it done while you're asleep under IV sedation or general anaesthetic. If you think there's a chance you may want to have children in the future, it's best not to have a vasectomy and use other forms of reversible contraception like condoms or female forms of contraception like the pill, Mirena or Implanon. Before I explain the vasectomy operation, it's helpful to know a little bit of male anatomy. Within the scrotum are the testicles where sperm is made, and coming from each testicle is a tube called the vas deferens, which transports this sperm. After it leaves the scrotum, the sperm is added to seminal fluid, and this fluid and the sperm is what your ejaculate is made up of. A vasectomy operation involves cutting and blocking the vas deferens tubes so the sperm no longer goes into the ejaculate, and there are a couple of ways to do this. One way is to use a scalpel to cut into each side of the scrotum and then find the tubes and cut them in half. This is called a traditional vasectomy, and this will require stitches to close the two surgical wounds. A newer method is called the no-scalpel vasectomy, and as its name suggests, does not require a scalpel, but rather sharp forceps to make a single keyhole incision in the front of the scrotum. Through this hole, each of the tubes is pulled out of the scrotum and cut in two. Before it is returned back to the scrotum, your doctor will make sure at least one of the ends is closed or sealed off. This is usually done by burning or cauterizing the end. The other end may also be closed. This is called a closed-ended vasectomy, or it may be left open. So when you hear the expression open-ended vasectomy, it's referring to the end of the tube closest to the testicle being left open and allowing the sperm to flow out into the scrotum. The reason for this is to reduce the pressure of sperm backing up into the testicle and causing congestion pain. There are generally two types of doctors who perform vasectomy: urologists and other doctors who may have a background in general practice, emergency medicine, or any other medical specialty. And the last time Medicare were able to compare the data, both groups did about half each. Urologists are specialist surgeons who have completed training in the genitals and urinary tract and can perform operations in this area of the body. This includes the kidney, the bladder, the prostate, the testicles, and anything in between. Most urologists will perform a vasectomy under IV sedation or general anaesthetic, meaning you will have to have your procedure in a private hospital. You will also need a referral to see a urologist, so you must see your GP before you book in with them. The other group are sometimes referred to as vasectomists, and some of these doctors have focused their entire practice on the procedure and do many thousands of cases per year. These doctors will generally do their vasectomies under local anaesthetic, so you will be awake during the procedure. This also means it can be performed outside of a hospital in a GP clinic, which can be substantially less expensive than a private hospital. So who's better? Well, it's not really possible to say, and it's dependent on the individual surgeon. Although urologists have a higher level of training in surgery, their practice is spread across many types of operations like prostate cancer, kidney stones, bladder cancer, for example. A doctor who only does vasectomies has perfected this one operation, and if we were to look at the 5 doctors performing the most vasectomies each year, it's extremely likely that all of them will be vasectomists rather than urologists. When deciding who does your surgery, the things you need to consider are: do you want to be asleep or are you happy to be awake? What is your budget? A vasectomist will usually charge an out-of-pocket cost of around $500 to $600, whereas a vasectomy in a private hospital with a urologist may be a few $1,000s. Do you suffer from pre-existing scrotal issues such as surgery to correct an undescended testicle? If so, you may wish to choose a urologist, although keep in mind, if you have lost a testicle to cancer or torsion, this does not change the complexity of the surgery, and these men can easily have their procedure done with a competent vasectomist. And finally, and most importantly, how experienced is your doctor at performing vasectomy, particularly if they are not a urologist? A vasectomist should dedicate a large percentage of their practice to vasectomy and doing at least 500 cases a year. I would not recommend choosing a doctor who only does a couple of vasectomies every week, as research has shown that doctors performing less than 50 cases a year have higher failure and complication rates. After your vasectomy, you will probably be sore for a couple of days, so take it easy and keep up the Panadol and Nurofen if you need it. Most men will have recovered by 7 days, 14 at the most. During this first week, you should avoid physical activity like going to the gym, don't lift heavy items, and refrain from having sex. If all is good after a week, you can resume these activities. Although vasectomy is usually safe and simple, no surgical procedure comes free of the risk of potential complications. The three main complications are infection, which can occur at the skin or around the testicles, bleeding, where you end up with a clot of blood in the scrotum, and post-vasectomy pain syndrome, or chronic pain in the testicles that is present 3 months or more after your procedure. Although it's important to be aware of these potential complications, the good news is that they are rare, and greater than 99% of men who have a vasectomy will fully recover after 1 week and have no ongoing issues. Keep in mind that when you have a vasectomy, you will not be infertile immediately. This is because there are millions of sperm in the upper tubes that need to be cleared out. This is usually achieved by having at least 20 ejaculations over a 3-month period. After this, your doctor will ask you to complete a sperm test, and if this comes back clear, you'll be able to stop using contraception. In the final part of this video, I'm going to go through some of the most commonly asked questions I get asked regarding vasectomy. Well, if you're having your procedure under IV sedation or general anaesthetic, it won't hurt at all because you will be asleep. A vasectomy can be performed under local anaesthetic without too much discomfort. There are a few minor stings to start the procedure to numb the skin and tubes. After this, you will feel your doctor moving things around, but it's very unlikely you will feel any pain. Most men are quite shocked that their vasectomy under local anaesthetic was essentially painless and much less traumatic than a trip to the dentist. The answer on both counts is no. Erections are controlled by blood vessels that supply the penis, and a vasectomy is performed well away from this area. Testosterone is produced by the testicles, and these hormones will continue to be produced normally after a vasectomy. No, you can resume ejaculation after a day or two via masturbation or other means. We want you to avoid sexual intercourse mainly because of the potential trauma to the scrotum during the act. If you have your procedure under IV sedation or general anaesthetic, you will need to speak to your anaesthetist, and it's probably best to avoid alcohol for a few days. If you have your vasectomy under local anaesthetic, you can have a couple of drinks on the night of your procedure. Most reversal surgeons will be able to restore fertility, but keep in mind it's not a simple procedure. I compare reversing a vasectomy to reattaching a finger. It's easy to cut off, but it's not that easy to put back together. The best advice I can give is that if you are thinking you might want to reverse your vasectomy, just don't have one in the first place. There really isn't such a thing as a laser vasectomy, as it's essential to cut the tubes in the scrotum, and you can't do this with a laser. Some vasectomy doctors use electrocautery like diathermy to cut the tubes, and this is probably what's being referred to here. Well, thanks for watching, and I hope this has given you the information you need to decide if vasectomy is best for you. If you have any other questions, just put them in the comments below and I'll do my best to answer them. Take care and bye for now.